Hi, I'm Vijay Bhatt. I'm a professor at the University of Nebraska Medical Center. We conducted an early phase clinical trial using a new drug called Dordaviprone. It is an oral once a week pill that we used in patients with acute myeloid leukemia or myelodysplastic syndrome who had undergone stem cell transplant. The purpose of this study was to demonstrate that use of this new medicine is safe in patients who have undergone stem cell transplant. In this study, we enrolled 20 patients with either acute myeloid leukemia or myelodysplastic syndrome. Patients were treated with various doses of this medicine, and we were able to increase to the highest dose that we wanted to use. And the study demonstrated that this medicine, when used after stem cell transplant, is safe, does not cause a lot of complications or toxicities. People are able to tolerate the medicine. In terms of outcomes, we demonstrated that 7 out of 10 people, or 70% of people, were able to be cancer-free and live at around 2 years after transplant. So in conclusion, this trial demonstrated that use of a new medicine called Dordaviprone after transplant is safe and may have efficacy to reduce the risk of relapse after transplant.
If our videos have helped you in any way and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.